though Dr. Fauci was too busy to appear before Congress today, he did manage to find time to go on PBS to fearmonger about the latest COVID variant.
It certainly is a game changer, Judy, for people who are not vaccinated. We have pockets in this country, particularly but not exclusively among certain southern states, where the level of vaccination is really dangerously low. You don't want to see two Americas, one that's protected very nicely because the vaccines work, and then certain pockets of the country where you can have these mini surges.
Of course, Fauci is ignoring the latest data on the Delta variant from the UK. It shows that of the more than 53,000 Delta cases among unvaccinated Brits, only 44 or 0.08% died after testing positive for the variant. Joining us now is Dr. Peter McCullough, epidemiologist in Dallas, Texas. Dr. McCullough, why isn't Fauci providing the American people with the important context here?
Well, he's not following the data, and it's very clear from the UK technical briefing that was published June 18th that the vaccine provides no protection against the Delta variants. It's a very mild variant. Whether you get the vaccine or not, patients will get some very mild symptoms like a cold, and they can be easily managed through it. If patients have severe symptoms or at high risk, we can use simple drug combinations at home and get them through the illness. So there's no reason now, at this point in time, to push vaccination. We have over age 65, the highest risk group in the United States. We have 77% vaccinated. The remaining patients who are not vaccinated are not vaccinated for good reason. They've either had COVID-19 or they can't take the vaccine.
And you believe that if you've had COVID-19, then you don't need the vaccine?
Well, that's right. Natural immunity is far superior to vaccine immunity. It's robust, complete, and durable. Patients who've had COVID-19 and they have a solid diagnosis with proof, or if they have antibodies or have the T-detect test positive from a prior suspected COVID infection, they're good to go. There's no reason why they should take the vaccine. In fact, 3 studies show increased harm if an immune patient does, in an ill-advised way, take the vaccine.
Wow. CNN's Sanjay Gupta had this to say about the Delta variant today.
The reason you're hearing about the masking coming back is basically still to try and slow down the spread of what is clearly a more transmissible variant, the Delta variant. This is 60% more transmissible than the UK variant was, which was 50% more transmissible than the strain before that. So you get the idea here. I mean, it's sort of this notion that the virus is still spreading. Let's see if we can do everything we can to really contain it now.
Dr. McCullough, if a virus is more transmissible, does that automatically mean it's more deadly?
Oh, no, not at all. In fact, we've had 12 randomized trials, most recently the DanMask trial, that shows no value to public masking. None whatsoever. Prospective randomized trial, the highest quality evidence that we have. So there's no need for masking in the general public. Each version, there's been fear-mongering. I remember when the UK variant was coming, there was great fear-mongering. That was a very mild variant. It wasn't a big deal in the United States. And at this point in time, the Delta will give us a small bump, but we're going to manage it very easily with medical therapy. I think only healthcare professionals, people working at close range, maybe barbers and others should wear masks. But for general public masking, there's no scientific support.
All right, Dr. McCullough, thank you very much.